Welcome to the Physiotherapy Shape Up education session. During this education session, we will be discussing pelvic floor muscles recovery, strengthening and care, transversus abdominis muscle recovery and strengthening, effective bladder and bowel habits, safe exercise, looking after your back, and handling baby. The pelvic floor muscles run from the bony part of your pelvis at the front, also known as your pubic bone, to your tailbone or coccyx at the back, and across underneath to the two bones that you sit on. The pelvic floor muscles work with your deep tummy muscles and deep back muscles and diaphragm to stabilize and support your spine. They also help control the pressure inside your abdomen to deal with the pushing down force when you lift or strain, such as during exercise. The urethra, vagina, and the bowel all pass through the pelvic floor. The pelvic floor is important to support the bladder, bowel, and uterus in women, maintain bladder and bowel control, and play an important role in sexual sensation and function. To activate your pelvic floor muscles, squeeze and lift the muscles around your front and back passage as if you were trying to stop yourself from passing wind or stopping urination midstream. You do not want to be squeezing your buttock or thigh muscles, holding your breath, or pushing down to strain. Start with a 3-second hold, as this is the length of time taken to recruit all muscle fibers in your pelvic floor, and gradually build up to a 10-second hold, up to 10 repetitions, and up to 5 sets daily of good quality activations. By the time your baby is 12 months old, you want to aim to hold for up to 10 seconds, up to 10 repetitions, up to 5 sets daily in a standing position. Pelvic floor muscle exercises are important to be completed regardless of whether you've had a cesarean or a vaginal birth. Consider tasks you do every day and use these as prompts to complete your exercises. For example, every time you feed your baby. The knack is a strong and well-timed activation of the pelvic floor muscles. It involves the pelvic floor muscles activating immediately before and during any increase in downward pressure on the pelvic floor, for example, when coughing or sneezing. It helps to support the pelvic floor muscles and prevent leakage of urine during these tasks. To protect your pelvic floor, it is important to avoid pushing and straining on the toilet and any heavy lifting. We recommend you avoid lifting anything heavier than the weight of your baby for the first 6 weeks. This includes lifting any heavy shopping bags and even full and heavy washing baskets. Therefore, it is important to ask for help with these tasks where you are able to. Other things to avoid to help protect your pelvic floor include sit-ups and crunches for at least the first 6 to 8 weeks, and high impact exercise, which includes running, hopping, and jumping for at least 3 to 4 months. The transversus abdominis muscle, also known as your deep tummy muscles, or TA, is the deepest layer of core muscle. As you can see from the diagram on the left, your six-pack muscles, or your rectus abdominis, sit on the outside. Underneath these are your oblique muscles, which run diagonally and assist with side bending and twisting maneuvers. Underneath your oblique muscles is your transversus abdominis. This muscle acts like a corset for your back and pelvis as it helps to provide stability to these areas. It also helps to reduce any abdominal separation after pregnancy. This is the only muscle which works together with your pelvic floor. During the later stage of your pregnancy, to allow space for your baby, your six-pack muscles can move sideways and stretch the connective tissue in between your muscles. This is called rectus diastasis and generally takes about 6 to 8 weeks post-giving birth to return to normal. To activate your transversus abdominis, place your hands on the bony part at the front side of your pelvis. Walk your fingers inwards towards your belly button twice and down towards your pelvis once, so your hands are on the lower part of your belly. Think about drawing your belly button towards your spine, and only the lower part of your belly should move. This exercise can be completed in lying, on your hands and knees, in sitting, or standing. You want to avoid sucking in air, holding your breath, or doing sit-ups or crunches. Sit-ups and crunches may worsen separation as they activate your six-pack muscles. If you are returning to swimming, avoid breaststroke for at least 6 to 8 weeks as it activates your oblique muscles and may worsen your separation. It is also important to avoid positions where your shoulders are lower than your hips while you are experiencing any vaginal bleeding or discharge. For example, avoid bridging exercises or downward dog. There is an additional benefit to women who have had a cesarean section because this exercise will help with the healing of your incision by promoting blood flow to the area. Aim to hold up to 5 seconds, repeat up to 5 times, up to 3 sets daily. By completing this exercise on your hands and knees, you will increase the resistance as the muscle has to work against gravity. It is important to activate your transversus abdominis muscles with any movement. This may include when you are rolling in bed, any change of position, for example, moving from a sitting position to a standing position, or when you are getting in and out of the car. It is also important to activate your transversus abdominis muscles with any lifting activity. This may include lifting heavy baskets of washing, lifting shopping bags, or any older children. Effective bladder habits include making sure you are well hydrated. Aim to drink about 2 litres of water daily. You want to aim for urine colour between 1 and 3 on the chart. Darker urine can irritate the bladder, causing pain, discomfort, and incontinence, as your bladder is not wanting to hold the urine, making it harder to manage or control your flow. You also want to avoid making your bladder overly full, as this can increase the risk of kidney issues, and excessive fluid intake may increase the risk of developing mastitis. Normal voiding frequency is 4 to 6 times per day and 0 to 1 times overnight. During the early stages post-pregnancy, it isn't abnormal that you may go up to 6 to 8 times during the day as your body has to process additional fluid. You want to aim for volumes of 1 to 2 cups of urine per void. This equates to a steady 10-second stream. If you're not having an urge to go to the toilet, we recommend timed voiding every 2 to 3 hours. If you have any concerns, you should see a continence physiotherapist. Effective bowel habits include avoiding constipation, as pushing and straining on the toilet puts a lot of downward pressure on your pelvic floor. There are 11% of people who have issues with their pelvic floor without having had a child, and this is likely due to poor toileting habits. Drink plenty of water, have fruit and vegetables and fiber to help avoid constipation. You may also need stool softeners if you are having difficulty. You want to aim for stool types 3 and 4 on the chart. If you have had any stitches, you may find it more comfortable to wrap your hand in toilet paper and support your perineum when you pass a bowel movement. The diagram demonstrates effective positioning on the toilet. This includes having your knees up higher than your hips, leaning forward with a straight back, and relaxing. You may find it handy to use a footstool to get you into this position. By adopting this position, you make it easier to pass a bowel movement. For return to exercise, we recommend for the first 6 weeks after giving birth, you focus on your pelvic floor and transversus abdominis muscle strengthening, and low-impact exercise, for example, walking, cycling, and swimming once your stitches are healed and bleeding has stopped. After the first 6 weeks, you can gradually return to exercise but you want to avoid bladder or bowel leakage, pelvic floor discomfort, or fatiguing of your pelvic floor muscles. You also want to avoid high impact exercise such as running, jumping, and team sports for at least 3 to 4 months, and sit ups and crunches for 6 to 8 weeks. With return to exercise, you want to start from scratch. For example, if you wanted to do a plank exercise but you were getting pelvic floor discomfort, you may want to consider modifying the position and trying a half plank position instead. If you would like further guidance on return to exercise recommendations, follow the link at the end of the slideshow for the Pelvic Floor First government organisation website. It is important to maintain good posture and avoid lifting anything heavier than your baby for the first 6 weeks. This includes being mindful with your return to housework. You may need to ask for assistance with any heavy lifting. Lifting too heavy too soon may put you at risk of developing back pain. You need to remind yourself that your body is healing, and this includes your core muscles, which often provide support to your back with lifting. Allow any muscle separation to repair before lifting heavy. We understand that this can be challenging if you have older children. If you have an older child that still wants to be held, we recommend using proper lifting technique. This includes keeping your back upright, bending your hips and knees, keeping the weight close to your body that you are trying to lift, and activating your pelvic floor and transversus abdominis muscles when you stand to lift. Using this position, you will be loading your legs and reducing the load on your back. You want to avoid any forward tipping at the hips for lifting, as this increases the load on your back. If you are picking up an older child, try and squat down as low as you can, hold them nice and close, and stand up. You may also consider sitting on the edge of a chair or the edge of the bed. Have your child climb up to your lap, hold them nice and close, and stand up. Once you have picked up the load, it is important to avoid any twisting, so instead move your feet. For example, please be mindful of your position when you're taking the pram out of the boot of the car. Remember that repetition adds up to load, and adopting safe lifting techniques and positions can help look after your back. Heat packs or hot showers can be used to help ease sore muscles. When using heat packs, do not apply the heat pack directly to the skin. Ensure the heat pack only remains on for up to 20 minutes at a time and use it throughout the day as needed. Ensure the heat pack is not too hot, as this could result in a burn. Stretching can also help to relieve tension in tight muscles. With stretches to achieve a therapeutic effect, hold for 30 to 40 seconds, repeat 3 times, twice daily. The stretches illustrated on the slide can help stretch your neck and upper back. The stretch on the left demonstrates slowly bringing your chin towards your chest, holding for 30 to 40 seconds, then slowly looking up towards the roof and holding for 30 to 40 seconds. The stretch in the middle of the slide shows you how to stretch through your chest and your upper back. With your arms outstretched in front of you, interlace your fingers and round through your upper back. You should feel a stretch between your shoulder blades. The second image depicts your arms outstretched behind you with your fingers interlaced. Raise your hands until you feel a stretch through the front of your chest. The stretch on the right shows you how to stretch the side of your neck. Tilt your head towards the side, bringing your ear closer to your shoulder until you feel a stretch through the side of your neck. You can place your hand on your head to increase the stretch. It is important to note with stretches, you should only go to the point you feel resistance, and they shouldn't be painful. As we discussed in back care, repetition adds up to load. Consider changing and bathing your baby at your waist to hip height rather than bending your back. You may consider alternate areas to change your baby. For example, you may consider kneeling beside a bed when changing your baby on the bed to avoid bending your back. With baby pouches, ensure that they have 2 wide straps and that your baby is sitting high on your chest to reduce the forward pull and loading to your back. Ensure your baby's legs maintain an end position in the pouch to assist with normal development of their hips. Ideally, you would like to start with short intervals of placing your baby in the pouch. Start with 10 minutes and gradually increase to up to 1 hour. Avoid using side slings as this has an associated SIDS risk. With feeding positions, you want to ensure your head, neck, back and elbows are supported. Use plenty of pillows to help to do this once your baby has attached. You may like to trial different positions when you are breastfeeding. For example, side lying. Aim to lie on your side and have a pillow between your legs to help maintain a nice neutral spine. You may also consider leaning back in a chair in a semi-recumbent position with bub on your chest. This can be useful because when your baby is on their tummy, you can stimulate the bottom of their feet, which increases the stepping reflex to help them to find the nipple, and stimulating the top of their foot causes a gaping reflex so that they open their mouth. Tummy time should be started straight away for your baby. Aim to accumulate up to 30 minutes of awake, supervised tummy time daily. This is important for your baby's development and their safety. For example, if they end up on their face, they are able to lift their neck and clear their airway. You can use different positions to achieve tummy time for your baby, including having your baby laying on your chest, having your baby laying across your forearm, or having your baby slightly over your shoulder, or even having your baby across your lap. To help prevent flat spots and tight neck muscles in your baby, you should alternate their head position when they are sleeping. If your baby is showing a head preference, we recommend you put their head on their unfavored side to sleep. Change cot ends to encourage head turn to their non-favored side, and place their stimulus, such as toys, on their non-favored side to encourage head movements to that direction. This concludes our Shape Up education session. If you would like further information, please follow the links provided or call the Calvary Public Hospital Bruce Physiotherapy Department.